A warm welcome to all our viewers who are watching us live today from all over the world. My name is Julia Sin and I'll be your interviewer for today. And I'm really honored to be joined by the CEO of HEKA Public Services, which is a very interesting consultancy firm. And we will get to know more about it from the CEO himself. And Dr. Mario, welcome to this interview. And thank you for honoring this
Thank you.
interview.
Thank
And
you
maybe you can
for inviting me.
You're welcome.
Yeah,
You're welcome.
for your time. Yeah.
Yes, and maybe you can be able to tell us more about yourself and what really motivated you to start HEKA, why HEKA, and probably what are the services that you can be able to get from HEKA.
Okay. Okay. Thank you. Um, for inviting me in this fancy place, and
Ooh la
yeah,
la,
the lights,
yes.
the sun, everything is perfect. Okay. You know me. I don't need to introduce myself to you, but for those who are watching us, I'm Mario Medegan. I'm a physician turned public health specialist, and my experience go from the community level, the grassroots level, to the health facilities level, and also to the central level. We work with government, local government in West Africa to assist them in formulating accurate policies in terms of public health in general for our communities. So that's my personal background. I'm a bilingual
Clearly.
professional, and yeah, with some colleagues of mine, we decided to launch this structure, this farm. The need was during our individual experiences.
Yes.
It was frequent for us to work on projects and programs where the strategies we were supposed to implement were not well adapted with our realities, with the communities we were working with, because the funding came from abroad, and yeah, the strategies always come with the fundings, so
Yes.
it's quite difficult for us to implement it. And yeah, and as we were growing professionally, when we reach the conceptual level, it's also the same problem. When you are designing a strategies, at times you have many pressure from different stakeholders.
Yeah.
And in the end, the work you put out is not exactly what you would like to, or what the community would need, what would be the best for the community. So yeah, it's easy to find, I would say 10 years ago, when I started, even as a trainee, medical student trainee,
Yeah.
easy to find, when you were in the field, in the rural community, to find, your supervisor is a Western citizen, not to throw any stone to them, but yeah, completely disconnected with the realities. At times your supervisor is not even a health professional, and yeah, you have to follow orders or instruction that are not really adapted to what is supposed to be done. So as we grow professionally, we decided why not to get together and create something from local professional, local expertise for local problems. That's the first concern of HEKA. Local expertise, local resources for local problems. Because without that, it will be difficult for us to give our communities what they really need.
Right.
So that's how we started a couple of years ago. But last year we decided to really establish it, register it, officially register it, and yeah, that's HEKA. We are based in Benin, our headquarters in Benin, but we have so many colleagues, so many consultants, individual consultants from all across the continent, as well as francophone as well as anglophone colleagues. So our services, yeah, from the very ground level. I mean, even from the baseline analysis, the baseline study, even before implementing, before starting designing any project,
Exactly.
baseline studies with once again with local expertise, with those who really know. We grew up in the field, so we know what we are talking about.
Right.
When we talk about communities, we are talking about our parents, our friends, our relatives. We are not talking about remote entities or remote people we don't even know. So we start at the very at that level baseline studies, project and program design, monitoring and evaluation, and now we are even talking about policies. As we
Yeah.
grow, even globally, we are now. By the way, we are here talking about. We met here talking about policy. So that's what we do. And the last born of our service is that data health data engineering, because the the need there was when medical or pharmacy students they are doing their research work. Most of the time they work with statisticians that are very good, but unfortunately are not from the health environment. So at times the language is quite difficult for them, to work with. And once they are done with those statisticians, they have hard time getting their work. I would say the way their supervisor, their professor would like it to be. So when they come back to us, fortunately, when the research protocol is already done, the data are already collected, it's hard for us to you know to fix it the way we like. So the service we are offering is, like, why not to start working with them from the beginning, from the research protocol, help them, not doing the job at their place, but or direct them, orient them, how to do it. So once the
Yeah.
data analysis phase come, it's easy for us to provide them the service, and also to have quality articles to publish.
Right.
No,
Right.
and we are partnering with a European journal that is ready to collaborate with us, because we share the same vision. Young researcher from Africa and global South need to publish for free, and also need to have free access to other published works. So
Right.
we are partnering with that journal, so we follow the all the process from the research protocol to the publishing in that journal. So that's the
Right.
last one of our services we
Okay.
want to make available for all the students, young researchers in Africa. Yeah.
And I think it's quite interesting for you offering that diverse, amount of services. And you've mentioned one important thing, like working with young professionals and students. These
Yeah.
are people who are also still learning throughout their journey. And I wanted to ask, does HEKA also, in addition to offering that support in terms of data analysis, collection, you also just provide capacity building
Exactly.
activities to them as well?
Exactly. Yeah.
Okay.
That's another one. Thank you for for reminding me this
Yes.
service. Yeah, we offer capacity building not only for students but even for health professionals,
Yes.
for specific public health thematic topics. And then when they need it, they need those kind of training or job, for example. We can design adapted courses, adapted training, and and give them. And you can find all those services on our website. It's a very nice website,
Yes.
well
We're going to
designed.
put the link down there below for
Well
people to
designed.
access.
So
Yeah.
that's it.
Okay. And also another thing, you've said that the secretariat is at Benin. The main offices are in
The
Benin.
headquarters.
And you said you work with also, you can offer your services from all around, the continent. Are you able to just give us a few or mention a few countries where you are, heavily involved, so that people can be able to know that, you're also working in our country,
Yeah. But to start, West
Yes.
Africa is our cradle, is the
Yes.
beginning.
Yes. Yes.
All the exhaustively, all
Okay.
the West African countries.
Mm-hmm.
In Central, we work in Congo, we work in Cameroon.
Mm-hmm.
We have colleagues almost every in Chad,
Yes.
and here in Eastern and South, and in
Yes.
Nairobi is my second home. Kenya is my second home, you know. So yeah, we are very involved in Kenya, Tanzania, and yeah, we worked on a couple of projects in many countries in
Mm.
Eastern and Southern as well.
Mm.
Yeah,
No, I like that. And I like how you sound so passionate with what you're doing. And now shifting from HEKA and coming to you as a person
yeah,
and your passion and
yeah,
looking at how you have this wide range of experience in the field and
yeah,
also project management.
yeah.
What do you think we can be able to like learn from that? Or what is like one thing that you've learned throughout your experience that you would want us and the viewers and the young professionals to be able to take home?
Okay. Yeah. It's what I've already said.
Mm-hmm.
We can't thrive. Our communities can't
You're right.
thrive without mobilizing local
Mm-hmm.
resources,
Mm-hmm.
local expertise for our own problems. We can't thrive with imported strategies and
Yes.
resources. That's what we need to put out,
Mm-hmm.
definitely.
Mm-hmm.
And also, um, from that experience, what I can say is we need to be proud of ourselves, of this young generation
Yeah.
we are part of. Yeah, I've had the chance to meet so many amazing colleagues,
Mm-hmm.
young colleagues,
Mm-hmm.
and yeah, they're so well skilled, so
Mm-hmm.
well trained, so well connected,
Right.
and that's something we need to leverage on. The 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 sense of collaboration, of
Yes.
networking of the young generation,
Mm-hmm.
that is a bit difficult at the highest level of
Mm-hmm.
the country level, because young young professionals, they
Mm-hmm.
collaborate very easier than government and countries.
Mm-hmm.
So when we talk about integration, African unity, we need to leverage on that, this young generation of us.
Mm-hmm.
And yeah, and that's how what I can say from my experience. Yeah,
Okay.
yeah.
Thank you so much. And being in the public health space, what are your thoughts around the public health system in Africa right now? Do you think there's some sort of sovereignty? Or what would you say more about that?
Yeah, it will be hard it will hard for me to talk about sovereignty, because
Yeah.
let's start with the data, our data
Yes.
sets, our epidemiological data.
Mm-hmm.
Most of the software we use to collect and aggregate them, we don't even own the licenses.
Mm-hmm.
You know what
Mm-hmm.
I'm talking about. We don't,
Yes.
we don't even own the
Yes.
licenses,
Yeah.
and our database are stocked somewhere else.
Mm-hmm.
And you know how important data is in
Yes.
health system.
Yes.
Just see the way when Donald Trump came, one of the first thing he wanted is to shut TikTok down, because he he thinks that they were collecting too much data
Data.
from his population.
Mm-hmm.
That's the importance of data. There's so many things we can do with data, and if we don't even own our data, is
Mm-hmm.
difficult to talk about sovereignty. So
Mm-hmm.
that's one of the concern of HEKA,
Mm-hmm.
how to build our own, data bank,
Mm-hmm.
and yeah, own it, and yeah, design the strategies we
Mm-hmm.
think are the best of our communities.
Yeah.
Yeah, with our own data,
Mm.
manipulate our data the way we like. Because when someone own your data, it can they can they can make you think what they like, what
Yeah.
they want
Mm-hmm.
about your own health condition, about your own health situation in your
Mm-hmm.
country.
Mm-hmm.
So that's one of our concern in the
Okay.
long run, in the long term. The article we will be publishing, the program and project we will be implementing,
Mm-hmm.
all those data, put them on our own server,
Right.
and know and give free access to our professional, our researcher, you know, because you know how hard it can be when you want to do a research work, how hard it can be to find articles related to your situation, to your
Context.
context,
Yes.
So in the long term, imagine us having our own bank, you know, when any researcher can come anytime and search it and find what they need, and also have the sovereignty of our own data. That's what I call sovereignty. So now it's difficult for me to talk about sovereignty in
Right.
in the situation we are right now. Yeah,
Right.
yeah.
And in experience, still looking at this public health system that we are in Africa, right? Do you think that we have some strengths that are really still underestimated? Or what have you identified, like some of our strengths that will enable even you as HEKA to strive further, leveraging on some of the strengths that we have
Yeah.
in Africa?
Apart from the young generation of so well skilled, so talented
Yes,
professional
right.
I just talked about, I think even our community, the community engagement, our community are ready to help out because
Right.
they are concerned. At times we tend to think they are ignorant, they don't know what's going on, but they are ready to collaborate, they are ready to give data, and also they are ready to assist in the implementation of the programs. And at times that's my personal point of view. We treat them just like pass me the word. Just they are just there to to support or to bear the burden of the health issues going on, and we overlook their capacity to contribute
Yes, to
in
contribute and to
resolving.
lead as well.
Yeah, exactly, to resolve to give solution to those problems. So
Yeah.
yeah, those are those are the strengths I think we overlook at times. Yeah.
And looking at the world we are in today, we know there are a lot of consultancy firms, sorry to say, in public health. So what is HEKA doing different, or how is your approach different from the other firms?
Oh, okay. First of all, in our West African, especially our Francophone contest,
Yes.
we did the baseline
Yeah.
analysis, situational, because it's part of our job
Yes.
to do that. And
Right.
yeah, first of all, there's nothing. The need is really crucial there. There's nothing on the ground like what we are offering. Such a
Yes.
comprehensive solution, such a comprehensive offer. There's nothing, and multi skill, multi language, and yeah, there's nothing like that, and that's what we are bringing on the table. Our mastering of the field, because we really know what we're talking about when it comes to the field, the community, and also yeah, the different horizons of experiences, and yeah, that's what we are bringing to the table. That's what we are doing different,
Yeah.
and the quality of our outputs.
Okay.
Yeah, we want the quality to talk for itself,
Okay.
in the midterm. Yeah.
And you being a physician and
Yeah.
also a public health specialist, and I know your team also comprises of public health specialists, back to the students that
Yeah.
you offer support with, is there a certain discipline that you're looking at in terms of are you to only support public health students, or also the ones in the medical field who are still doing research? So what is the category of
Yeah.
students that
No,
you are?
public health students are not even our priority, because
Okay.
them they're already trained or
Yes.
being trained with statistics, epidemiology, and everything. But the medical student, me being I used to be one, so I know.
Yes.
Our training, our courses in terms of epidemiology and statistics,
Yes.
it's just a couple of hours, and we are not really well equipped. So,
True.
pharmacists and other health-connected disciplines, those are our priorities to help them put out quality work, and article that are defendable anywhere,
Yes.
at any level. Yeah,
Yes.
that's our priority.
I totally agree with you. As a pharmacist, I can attest that even our training, we
Exactly.
had very
Just a couple of
short,
hours.
just a couple
Yeah,
of
yeah,
hours for
yeah,
the
yeah,
statistics.
yeah,
So, and then when you come to
exactly.
the real world, you're like, oh my God,
Exactly.
all right,
Yeah,
now this is really hard.
yeah, yeah.
And definitely the need is there in terms of, more support and everything. And looking at HEKA in the next 2 years, what would you say are your two key goals that you want to achieve
Okay,
in the next 2 years, and
okay.
also looking at the shifting of the global of the African like public health landscape with everything going around, what would you say is your goal for the next 2 years?
The next 2 years,
Right.
this is quite short time,
Yeah, I know
but
you have a lot, but
yeah,
yeah.
we have a whole vision.
Yeah,
But
okay.
yeah, in the next couple of years, already make the services available for everyone, and so we are starting the communication phase. The website is www.heka global, HEKA
Okay.
global.org.
Okay.
So all the services are there, or everything is there, automatized, and yeah, even for the to charge your documents, even just to schedule a meeting call, just to let us know your needs, and we will design together your project. So in the short term, because 2 years for me is short term. Okay, make the service available for everyone, from the student to the internal institution.
Yes.
Let them know we are here providing quality services and with local expertises, and they won't need to, start going too far from the field. At times it can be frustrating
Right.
when you see a program implemented locally by a local team, but when it comes to evaluate it, you see a foreign team coming from abroad to evaluate that project. Why not seek for local expertise? Even when we say it's an external audit, but we can find local professionals that know all the factors that can influence the program or the project to evaluate it as well.
Right.
So that's what we want in the short term, to make the service available, to build a name,
Yeah.
start building a name by the quality. Yeah, that's our first concern. Now, in the long run, what I talked about the data bank,
Yes.
talk about sovereignty,
Yes.
contribute to that sovereignty of our continent in terms of health, public health, so build something consistent, robust, a system where we know that we were there from the research protocol, so we can be sure that it's a quality work, and also stock that work somewhere to give access to any new researcher, That's something we also want in the long run, where we have
Interesting.
international reviews, we have
Right.
international journals, scientific journals. We can build something like that on our continent as well. A reference, a nice reference. Yeah.
Right. And so if I would want to get help or assistance from HEKA, or I would want to work with HEKA, you've mentioned the website, or basically just tell us how we can go about it, who we can reach to, where can we get the contacts,
Yeah.
are you on social media,
Yeah, we
and
are.
which platforms are you in? So yeah.
LinkedIn is the most used.
Okay.
Yeah. So we publish that every day, almost every day, and yeah, all the contacts are there. Even our physical contact, our physical address You can find it on the website and our social media on LinkedIn. Yeah. You can give us a phone call. You
Right.
can schedule a meeting call.
Right.
You can send us your project documents, and yeah, we'll assist you throughout.
Okay.
Yeah.
Nice. Well, that is interesting. And
Yeah.
maybe as we close, is there one closing statement you would want to give
Oh,
to the viewers, to the young professionals, or to the young physicians? You're a
yeah.
physician as well.
Yeah.
I'm sure some people will be really mentored by you. Is there one thing that you would like to actually provide, yeah, to the health professionals?
Okay. My advice once again is we need to be proud of what we are building on the continent, as young professional. Uh, don't be shy anymore. We need to be vocal. We need to express ourselves and know that we are doing good and we are doing so much with so
So
few
little.
resources, and
Exactly.
that's a competence, that is key. We
Yes.
need to be proud of, and yeah, um, I keep on searching for more knowledge, more training, and yeah, keep connected with other colleagues from other regions of the continent, and yeah, and together let's build something, sustainable in the long term. Yeah,
Wow.
yeah,
Thank you so much for this brilliance that is oozing from you. I think it was an honor listening to the CEO for HEKA,
yeah,
and we look forward to interacting with HEKA more on a,
yeah.
on a,
Thank
on a
you.
professional level. And I'm sure we are going to put all the
Yeah, the
accounts
links. Yeah,
in the description below, as well
yeah,
as the website link, the link to
yeah,
the website,
yeah, yeah,
and also probably the contact
yeah.
person. You'll be able to reach out to Dr. Mario for any assistance that you would want, or maybe if you want to hear
Yeah.
more from him. But from us, that is it, folks. Thank you
Thank
so
you. Thank
much.
you. Thank you.